Hi guys, Dr. Carrie here. Today I'm going to be explaining the benefits of an improved range of motion, and I'm also going to be teaching the daily ranges, which are 13 moves that you can incorporate on a daily basis to restore proper range of motion and guarantee better performance. So the daily ranges is a concept that I coined over a decade ago now, and I've used it with everything from high-end athletes to sedentary people as an easy way to start improving range of motion. What is range of motion? It's the motion that a joint should go through in its regular movements every single day. So a lot of our joints don't necessarily get to the end of their range every day. In fact, most people's heads only work in this type of motion. They never actually go all the way to the edge. And when we don't move our joint, this is a shoulder and this is an arm. And when that joint doesn't actually move through the entire range every single day, we tend to get some buildup of maybe a tendonitis in one area of a joint system or a joint complex like the rotator cuff here, or a tendinosis, or we might even actually develop some bone spurs. And if you have bone spurs in a certain area, this is even more important because you want to remind your body on a daily basis what you expect of it. And if you continually move your body through the proper ranges, as your body is laying down new tissue, it will start to work on aligning that tissue in the proper orientation. Also, through the process of range of motion, you're going to start to bathe those joints in synovial fluid. So like the ball of the shoulder of your glenohumeral joint will have water bathing the entire humeral head. And that's our goal. But if we just sit here and we just type all day, we're not necessarily going to get fluid into the top part of our shoulder. So this is why I came up with the daily ranges. A lot of this work comes from the work of a famous physical therapist, Robin McKenzie, coupled with chiropractic techniques and the orthopedic evaluation. So we're gonna start by standing on an even surface, and we're gonna start with our head and work our way down to our feet. I like to think of this as what we learned in third grade as head, shoulders, knees, and toes, right? So all we're gonna do for working with our neck is we're gonna start with retractions. Retractions is simply pulling our necks straight back. So our goal here is that you're keeping your head even and you're not allowing your shoulders to move. Sometimes this can be rather challenging as the back of the head is a condyle and it rocks like a bowl would inside of a bowl. So it makes it sometimes a little bit difficult, and your brain wants to either rock your eyes up or rock your eyes down or move your entire chest. So lots of times I recognize doing this in a mirror so that you can see that it's only your neck that's pulling back. When you're looking at yourself, you should see that you're actually giving yourself a double chin. If you're doing that, then that's the right motion. One of my teachers had explained this to me like a girl, like someone's pulling you by your ponytail, and for a guy, like an ugly lady's gonna kiss you. So just keep pulling that chin backwards. Excellent. All of our ranges, we're gonna try to do 5 to 10 reps. Now we're moving to right lateral bends, keeping our shoulders even. We wanna see that we don't have motion here, and we just are seeing the neck move. Lateral bend is one of the first ranges that we lose as we age because the uncinate processes in the cervical spine tend to hypertrophy and get arthritic. So just in your natural angles, if you ask a young child, their ear can usually go all the way to their shoulder, and elderly sometimes can't move much past this. But by working with what your natural range is, you're also going to help improve your sense of balance and decrease the chances of getting vertigo. A lot of times we haven't moved our head all the way to the end of the range since 1982. So we need to get in here and remind the brain. We used to hold our phones like this, remember? We need to remind the brain that we expect the ear to be able to laterally bend towards the shoulder every day. Once you've done 10 on one side, you move to 10 on the other side. We never go back and forth with these ranges. One, because we don't want to get dizzy when we're talking about the cervical spine. Two, if we go back and forth, we tend to not spend a lot of time at the end of the range. And the goal here is to spend time at the end of the range. Okay. Now that we've completed the lateral bends, we're moving on to our third range, which is cervical rotation. We're going to do 5 or 10 to one side and then 5 or 10 to the other side. Usually takes 3 or 4 before you start to notice that where the motion is restricted, where you have extra motion. Again, keeping our chest and shoulders even and focusing on just that neck doing the motion. And we're going to turn the other way. Patients always come in and tell me that their neck bothers them only when they back out their car. One of the reasons that is because their chest is strapped into the seat with the seatbelt, right? So they don't have the ability to turn their head. Where a lot of times if someone just says, hey, Dr. Carrie, they'll tend to just, what? You turn your whole body. Well, we don't always take the opportunity to turn our head all the way. And in theory, our head should be able to come all the way over past our shoulder. So you can kind of see it from the side angles. That would be ideal. Making sure we're keeping our chin even and not allowing our chin to angle up or for us to take our shoulder with us. Okay, we've done the first 3 retractions, right and left lateral bend, right and left rotation. Now we're into our shoulders. So for our shoulder joints, our glenohumeral is a ball and socket. And when you have a ball and socket joint, we roll that. Our neck is not a ball and socket. That's why we never roll our neck, okay? That was how all of the workout videos in the 80s used to have you do it. We don't want you rolling your neck. So you're just going to be working through this range. We're going to do 5 small in one direction, 5 small in another direction, and then we're going to do large. When we do our shoulder ranges, I want to make sure that your trunk is not moving. A lot of times when your shoulders are tight, you'll have a tendency to arch back to make up that difference. We don't want any arching back, okay? You want to hold your core nice and strong so it's in one position and all the motion just comes from the shoulder blade. The other thing that you want to keep your eye on when you're doing your large shoulder rolls is that as your hand comes around, your thumb stays down through the entire circle. Okay, if you open up your hand as you work around in the circle, you won't be working all the way up here underneath the AC joint. And then we really want to make sure we get fluid into the top of the shoulder. So in an ideal world, your shoulders should be able to touch at the top, your fingers should be able to touch at the top of this motion and work its way around, okay? Once we've done 5, I'm going forward, and now I'm going to switch and do my 5 backwards. Really trying to focus on touching at the top, and you can really start to feel that blood flow just by doing this motion into the bottom of your shoulder blades, which can really energize your shoulders, especially if you've been sitting with your hands below the horizon like you would at the computer for hours. So it's really great, even if you just put some time with your hands over your head, to get the bottom of those shoulder blades to really start to open up for you. Okay, so that's the glenohumeral part of the shoulder. The second shoulder range of motion that we do is for the AC joint, which is the top of the shoulder. And in that case, we're going to be doing internal, external rotations. So our hands are going to be like so. And we're working on making sure we're 90 degrees. So if we look over or we're doing this in a mirror, our arms aren't down, and they're not up and like this. And then from a side angle, they're nice and straight. They're not forward or backward. So once we're in 90 degrees, we're going to turn inwards and outwards, and inwards and outwards. A lot of people notice a dysfunction when they start to do this motion. And it's okay if you can't get your hands all the way down. I'd rather you keep your shoulders in the right spot, not crunching them here or dropping them back. Another great way to perform this is up against a wall where you can force and make sure that scapula stays in its plane and only move that arm through that range while you're maintaining a nice connection of your shoulder blade to the wall. We don't want to see any of this. And you're really going to start to feel that loosening and working out some of the stagnant tissue in the top of our shoulders. Great work. Now we're done with our shoulders and we're into our trunk. What does our trunk do? What does our midsection do? It twists. All of the ranges I've shown you so far can also be performed on a gym ball or in a chair. But I like to show this one sometimes to you seated because when my pelvis is planted, you can see I can get almost a little bit more trunk rotation than I can when I'm standing. Either way works. We don't want you not to do it because you don't have a ball or something to sit on. These are great exercises to be doing when you have been seated or been sitting in the car for a couple hours. And the other way. Turning. Beautiful. Good. Twisting that open, making sure that the motion only comes from your rib cage like this. You're pushing your hips forward and straight ahead of you, and you're not letting your hip twist with you. So none of this motion. 8, 9, and 10. Wonderful. Now that we're done with our rib cage, we're moving into our lumbar spine, these blue vertebrae at the bottom here, okay? And the lumbar spine is going to bend forward and backward and right and left, which is 4 of our range of motions. So I like to put my hands on my hips so that I know I'm not going to be bending anything from my hips down. And I'm just going to bend forward and back up, and forward and back up, and forward and back up. If you're seated, it's going to look like this. Trying to lead with the head, pulling all the way down and back up. Head goes first, and we return back up. When we're doing the standing, we want to make sure that our pelvis doesn't move backwards. A lot of people, when they start this, they keep a flat back because they're protecting their lumbar vertebrae like a deadlift. This is not the motion that we want for this exercise. We want to make sure that we're holding this area really still, and we're picking our spine up in an upward axial direction and then just slightly bending forward. Up and slightly bending forward. Up and slightly bending forward. Opening up the facets of L5 through L1. So it's not a huge motion. You're only feeling that motion right through here. Another great trick for this one is, I know this is a little tricky, I like to stand with only about an inch away from the wall. And then as I go forward, if my buttocks hit the wall, I know I'm leaning forward, and I don't want that. So pretend you're kind of like in a piece of concrete up to your waist, and you have to pick your body up, and you have to reach for something you dropped right on the other side of this concrete wall. And you're stuck, you can't go backwards at all, so you gotta use your lumbar spine. You really feel the hydration moving into the facets and kind of the fluid within the discs moving around in this position. Now the counter pose for this is gonna be extensions. Same concept, hips aren't moving. We're reaching up and back. 2 of the things I see people doing wrong with lumbar extension is they'll tend to move their head backwards a lot, and sometimes they'll get a little dizzy. You don't need to move your head. Your head can stay even with you, but you're picking your body up and back. I know if you have some arthritis in your back, it's kind of hard, and you're gonna have the tendency to want to bend your knees forward. We don't want this. Or your brain wants to make you happy and wants to make sure you get there any old way it can, so it comes up with all kinds of nutty things to do. But you wanna make sure that you're not letting your body go forward. So again, you can use the wall for a reference point to make sure that your hips don't go forward. And you're completing 10 extensions. That helps move the fluid from the back of the disc in your lumbar spine to the forward part of your disc in the lumbar spine. So if you've ever gotten up from seated in flexion for a long time, like in a car at a desk, and you're a little bent forward and you can't move, I really recommend you're doing extensions and standing before you start walking into the rest area, okay? Now we move into lateral bend of the lumbar spine. Good. And then we're out of the spine after this one and into the pelvis. So lateral bends are usually somewhat easy for most people. If you've gotten a little tweak, sometimes you can't. You want to kind of keep your hands sliding down to the edge of your knee, making sure your hips aren't jutting out and you're still holding that core nice and strong in the middle. And the other way, after you've done 5 to 10, I always recommend that you do your ranges every morning. I say while your coffee's brewing or your water's boiling, you can just do these in real time. It shouldn't take longer than a minute to perform each one, even less. So you should be able to do this in 6 to 10 minutes. Okay, and now we're to our pelvis. And our pelvis is this big circular circumferential thing on the bottom here, right? So there's lots of motions that our pelvis needs to do that our body doesn't do. How many people are good hula hoopers? Not that many, right? But we need to be able to move our pelvis as such. Then we'll get into our hip. A lot of people don't even ever talk about their pelvis because they only refer to pain in the back and in the hip. But the pelvis is really, really important. And it's a huge generator for problems and dysfunctions that we often refer to as hip pain or low back pain. So what we like to do just from an active standpoint is just side glide, active side glide. Right hip right, left hip left. Making sure that you're keeping your shoulders even. I always like to say, let's keep a glass of water on top of our shoulders. And we can't spill them, so we're not bending our upper body like this. It's our hip side to side. Beautiful. And then we want to isolate this into singular passive side glides. So we're going to put our shoulder up against the wall. And we put all of our weight on our shoulder. And then we step our feet away from the wall on the right angle. And the arm here comes to 90 degrees. And we're just going to pressure into the wall and pressure back out. And pressure in and pressure out. Just letting the pelvis slide into the wall and come back out, and slide into the wall and come back out. Since I don't have a wall to show you this as a reference, in the video notes below, there'll be a link to a PDF where you can print these off. And then I always recommend hanging them in your bathroom on the wall so that you remember to do them every morning while you're getting ready. Make sure your shoulders stay even and your pelvis stay even, and we're just gliding in and out, letting all that pressure. If your pelvis hurts or you're having a lot of back pain or spasms today, you can step a little closer to the wall and don't have maybe all of your body weight with this movement. But the shoulders against the wall and you're just pressing in. And that's your side glide. Only 2 more ranges. Now we're to our hip. Our hip is our next ball and socket joint. The shoulder, the glenohumeral, is our first ball and socket. The hip ball and socket is going to have the same type of motion. It's going to be circumferential, okay? So we're going to bring our leg up and around into a circle motion, just like so, okay? Trying to make it nice and smooth. A lot of people will tell me when they're doing their hip ranges that they get a lot of cracking and popping. That's okay. It's not our ideal situation, but a lot of us have some areas of adhesion in our ball and socket joints. Once we've done those 10, we're going to do the same hip going the opposite direction. So outwards, in and down. Outwards, in and down. Outwards, in and down. If you notice that while you're performing this, you're spending more of your attention on balance, that's not what we want. So I prefer you to use a wall. I'm going to switch to my other side now. But when you are using the wall, try to only have a little handhold. So you're not leaning leaning against the wall, which makes it change the whole motion like this and makes it a lot easier, okay? So you just want a little finger hold so you make sure you get through the motions. You've done 10 in one direction and then 10 in the last direction. And that brings us to our very last range of motion, which is just our physiological sit. And all we're gonna do is squat down to the ground like so. So I am up on my heels. I'm gonna turn this angle so you can see me. And I'm just kind of rocking back and forth. You can hang on to something like the kitchen counter or your bathroom sink or your bed. You don't have to hang on to anything. And you just kind of want to roll forward and backward, breaking up a lot of the adhesions in the lower legs and the ankles, the plantar fascia and the knees. Try to do a couple little circles and ankle rolls in one direction and then the other. And then you've gotten all of your ranges nicely bathed in your synovial fluid and you're ready to start doing your warm-ups. So thanks for joining me today for your daily ranges. If you have not already, push the subscribe button so you can get all of these tips and tricks and biohacks that I do. Dr. Carrie's goal is the goal of the Dr. Carrie station here is to help you reduce your pain and improve your performance so that you can